Hello. Hi, everyone. I'm Rendy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here to deliver our Monday 2:30 Facebook Live update on the impact of the COVID-19 pandemic on Mobile County. Let's see. In Alabama, we're approaching 550,000 cases of COVID-19 and 11,200 deaths. And interestingly, Alabama has approached giving away 3 million doses of vaccine, so putting nearly 3 million doses in arms, which is a great accomplishment. But just to give you a little bit of context, we're still second to last of all the other U.S. states in getting vaccine in arms, second only to Mississippi. So please, please, please do your part in trying to help Alabama get more shots in arms by finding a very an easy, safe location near you to get vaccinated. We'll talk just a little bit more about that in a second. So in Mobile today, we're reporting on 41,842 cases of COVID-19. Just 8 cases were reported to us yesterday. And we're seeing on average less than 200 cases per week, which is great news. Good job, everyone. We have 822 total deaths. No new deaths were reported to us yesterday. On average, we're seeing just 2 to 3 deaths per week, so that's really great news. The cumulative number of people hospitalized in Mobile with COVID-19, 2 were reported yesterday. The total number is 5,044. On any given day in our area hospitals, we see, somewhere in the mid-20s is the number of people who are in the hospital on any given day with COVID. And again, most of these people are old and, older populations, but we do occasionally see young people who get COVID and are sick enough to be hospitalized. In fact, CDC published a study last Friday of about 204 adolescents. So these were people 12 to 17 who had been hospitalized, who had laboratory confirmed COVID and had been hospitalized. Nearly a third of those required admission to the intensive care unit. 5% of that 200 required mechanical ventilation. And luckily, among this sample, none had died. But just remember that COVID can still be a serious disease in people who are 12 to 17, and they can now get vaccinated. So it's a safe and effective vaccine. No reason to continue to see adolescents hospitalized with COVID, because we have a vaccine that protects against severe illness. It also, will allow kids to safely join group activities. So if you're going to camp, or if you're participating in sports or bands or choirs, any group activity, if you can get your 12 to 17-year-old vaccinated, or 12 and above vaccinated, then they can participate in those activities with some security. And again, the vaccine is free. We have it everywhere, and it's a very safe and effective vaccine. So please, if you can, if you've not been vaccinated yet, maybe it's just been convenience, or you just don't have a convenient time to go. Maybe you just think, well, I'm a young, healthy person. Why should I get vaccinated? But we need everyone to get vaccinated to get that herd immunity that's going to protect the ones that are more vulnerable to severe complications, hospitalizations, and deaths. So in Mobile County, about 100 and just over almost 126,000 Mobile residents have been vaccinated, have received at least one dose, but that's only about a third of our population. We have really good vaccination rates in older populations, so people who are 65 and over. Nearly 70% of you have been vaccinated. Thank you very much for doing your part to keep us all safe. But particularly in those young categories, less than 50 years old, it's like, 25% or less. We've got a lot of work to do to try to get younger populations vaccinated to try to protect our entire community. It's not just about older folks protecting older folks, right? We need all the young folks to help us protect your aunts and uncles and grandparents and great-grandparents, to protect them from COVID infection that might cause them to have severe complications and hospitalizations and deaths. So the Mobile County Health Department, you can go to our MCHDcares.com website any day. We have a variety of vaccines given. I think last week we did 20 different vaccine events around town, give nearly 450 doses last week. That's a combination of both first and second doses. We have several events going on this week, including today. But go to mchdcares.com or dial 251-410-MCHD. One thing that will remain consistent, we've been holding vaccine clinics at our New Bern Health Center location for probably about a month now, and every week we've been adding more availability. So starting this week, Monday through Friday, 9 to 3:30, you can get any COVID vaccine that you want at the New Bern Health Center. So we're offering Pfizer, Moderna, and the J&J's Janssen vaccine at our New Bern Health Center at 248 Cox Street. And we offer walk-in, no appointment necessary COVID testing at that location. So again, it's one-stop shopping for all COVID vaccines and all COVID, any COVID, a rapid COVID test at our New Bern Health Center location at 248 Cox Street. You can also get vaccinated by appointment at most of our 8 locations around town. If you don't have transportation, you can't get to New Bern, or if there's a place, one of our clinics that's close to you, you can get an appointment there by dialing 251-690-8889. And then at our Keeler location, we have walk-in testing available every Wednesday and Friday. So lots of opportunities to get vaccinated or to get tested. Now, if you are homebound or, for medical reasons, or, if there are extenuating circumstances that don't allow you to leave your house to get vaccinated, we will come to your house. So we have a homebound mission. You can go again to our website, mchdcares.com, and click on the in-home vaccination tab to give us a little bit of information. Then someone will contact you and schedule your vaccine. And we're trying to accommodate requests. We'd like to vaccinate everyone with Janssen because that's a 1 dose and you're protected after 14 days vaccine. But we realize that some people would prefer to get a 2-dose vaccine, and so we're doing our very best to accommodate those requests. So again, lots of ways to get vaccinated. Please, please, please do your part to help our community. Get us out of that 49th place of all states that are are vaccinating, and let's see more Alabamians get vaccinated. So just a reminder before we end, can you get me the rabies location? Somehow I didn't end up with it. It's probably on my desk, Mark. So just a reminder that the Safer Apart order ended on May 31st. So there are no more requirements that restrict visitation at healthcare facilities, that require places to require a face covering upon entry. Thank you. There are no longer any limits on occupancy, that sort of thing. But it is still a really good idea if you are not vaccinated, if you're not fully vaccinated, it's still a great idea for you to wear a mask and physically distance when you're around people who aren't in your household, particularly if you are indoors. Being outdoors is better. We know there's a much lower risk of transmission when you're outdoors and you're spaced and there's, air circulating. When you're indoors, the airflow, ventilation is restricted, it's harder to distance. So if you are not fully vaccinated, it's still a good idea to wear a mask and distance, particularly when you're indoors and around people who don't live with you or you don't know their vaccination status. But fully vaccinated people, and again, it's 2 doses of Pfizer and Moderna in 14 days, or 1 dose of J&J in 14 days. After that 14-day, you can pretty much return to doing the things that you did before the pandemic started last year, March. So if you are fully vaccinated and you're healthy, then you can, be in a room with other people who are vaccinated without a mask. You can go outdoors without a mask. Some of the new camps guidance that's been coming out with CDC says, for when you have mixed populations, but when you're outside, be smart, but you can, remove masks. But again, if you have a mixed population of people who are vaccinated and unvaccinated, you still need to kind of distance and consider wearing masks where they're tolerable, because the 615 rule is still in effect. So far, the definition of close contact has not changed. It may, there's some talk that it may change, but for now, if you are around someone that has COVID within 6 feet for 15 minutes or more and you are not vaccinated, you will have to quarantine for 14 days. There's a 10-day option, but that does not, quarantine is not lifted. We're still enforcing quarantine for people who have known exposure to someone with COVID for longer than 15 minutes within 6 feet or more. So only if you're fully vaccinated can you be exempt from quarantine following an exposure.
No one is wearing masks. Are we in good shape since Memorial Day advance, or is it too early to tell?
Yes, so the question is asking about gatherings at Memorial Day. You guys know I always watch the data for 2 to 14 days following large gatherings. It looks really good. The numbers are low, hospitalizations are low, deaths are low. That's all really good news. And in order to keep the news good, we need more of you to get vaccinated, and then again, be smart when you're out and around. All right, so the only other 2 things to mention, as COVID has gotten, fewer cases, fewer hospitalizations, fewer deaths, the expiration of the Safer Apart order, and also the state of emergency order, we know that that's going to expire on July 6th and not be renewed by the governor. So you'll start seeing some changes in our sort of operational tempo that reflect sort of, a very low point in the COVID outbreak for us for now. So starting today, the Alabama Department of Public Health will only update their data and surveillance dashboards on Monday, Wednesdays, and Fridays. And their vaccine dashboard will only update on Tuesdays and Thursdays. And it will not update on the weekends. So just keep that in mind. So if you see it and it looks the same as it looked yesterday, please don't call us. Don't call Mark. They are updating it less often. So you will see that. We will probably, the Mobile County Health Department, will probably make some changes in the rhythm of our reporting and the manner in which we report to make it a bit more passive, about the same timing as the expiration of the state of emergency order, so by the end of the month. So we're trying to get some things in place so that we can continue to provide you daily information, but not to have to work our staff so hard every day to get that done. All right. Any other questions about COVID? Okay. The last thing is just to talk about, since we just do this once a week, just want to remind you that we have, low-cost rabies vaccination available for dogs, cats, and ferrets. This week's opportunity is June the 11th. That's Friday from 10 to noon at the Mobile County Animal Shelter on Howells Ferry Road in Mobile. And then on Saturday from 10 to noon at Pet Supplies Plus on 803 Hillcrest Road in Mobile. So remember, these are drive-through rabies vaccine clinics. Bring cash. It's $12 per pet. This is for dogs, cats, and ferrets. The rabies shot is good for 1 year. And yeah, that's good. Easy peasy. Just bring all your dogs in the car, load them up, make sure you're driving safely, and bring them in for one of our rabies clinics. And that's all for today. I will not be here a week from today. Someone else will be delivering our Facebook Live update, but we'll be here to let you know what's happening in Mobile with regard to COVID-19. Have a great week, everyone.